So then I would like to start. First, I would like to show you very nice buildings from Leuven. This is our university hall, the central office of our university. And this is a very nice view on the city hall of Leuven. But I am here not for touristic promotion, of course, and therefore I start with my presentation. Well, nursing ethics is important discipline in applied ethics, and one of the signs of this this importance is the fact that the journal Nursing Ethics, that you all know very well, celebrated its 30th anniversary last year in 2023, and it is now already developed as one of the important international journals in ethics. It is when we look to the impact factors, on the 6th place of the ethics journals. So that is an indication that nursing ethics is an important part of applied ethics. The questions that I would like to answer or to discuss during my presentation is, first, does nursing ethics need a philosophical foundation that is distinguished from medical ethics? So what is the relation between the foundation of nursing ethics and medical ethics? And then I would also give some suggestions regarding some thematic and methodological pathways we can go in the future for nursing ethics. So first, does nursing ethics need a philosophical foundation distinguished from medical ethics? Well, why is this an important question? Well, when you look to this slide, you see the prevalence of empirical studies in some bioethical journals, and one of these journals is Nursing Ethics. This is based on an empirical study between 2000, on papers published in bioethical journals between 2004 and 2015. And what you see here is that the percentage of empirical studies in nursing ethics, the Nursing Ethics Journal, is quite higher than in the other regular bioethical journals. You see a prevalence of 57% in nursing ethics. And then the second journal is the Journal of Medical Ethics, a regular bioethical journal. And there you have a prevalence of 25%. And then in some other journals like Journal of Clinical Ethics, 14%, Bioethics, 4%, Cambridge Quarterly, 3%, Theoretical Medicine and Bioethics, 0.7%, Christian Bioethics, 0.5%, and Hastings Center Report, 0.4%. So you see a very clear tendency that there is much more empirical research in nursing ethics than in medical ethics. So why is nursing ethics so empirically based? And that's a question that I would like to ask you. Why is there such a difference between a nursing ethics journal and a medical ethical journal regarding the prevalence of empirical studies? Do you know, do you have any idea why there are so many empirical studies in the nursing ethics field? I don't hear a reaction. Is that possible to say something or to give some reasons?
I don't know.
You don't know, yeah. Yeah.
We don't have facts, but we have opinions.
They don't have facts.
Yeah.
They have opinions.
We
Okay.
don't have facts, and they are guys are from Finland and a very practical person. And we have recently read research comparing doctors and nurses ethical practice in Finland and in US. And their position is different related to the patient. So nurses are in between. So physicians follow the ancient norms. They have the oath, and nurses are more in practical situations. For example, when the patient's denied for some kind of care or that, they are face to face making decisions, but they are not in a position to make individual decisions. They are always in relationship to other professions. This is my best idea.
Yeah, but I do not see the link with empirical studies because also doctors are in practical situations. They have to decide in concrete situations also.
Maybe the doctors have evidence-based recommendations, and they have more coherent society supporting and creating norms with them. But perhaps we nurses, we don't have this kind of sound ground in our practical decision making.
Yeah. Okay. Thank you. Well, another question is this empirical focus of nursing ethics a strength of nursing ethics or a weakness of nursing ethics? Is it good that we have so much empirical research in nursing ethics, or is it bad? Would it be better to have more philosophical based research also in nursing ethics? Well, that are all questions that one can discuss. I think one of the reasons why there is much more empirical research in nursing ethics has to do with the profile of the researcher, the nursing ethics researcher. And I think when we look to the typical profile of the authors of publications in nursing ethics, that many of these authors are nurses themselves, and nurses have a more empirical background, and they are experienced, and they are educated in using qualitative research and quantitative research, and that makes that when they are doing nursing ethics research, that they are using their empirical methodologies. When we look to the typical profile of medical ethics researchers or medical ethicists, then you see that they are not that much doctors doing research in medical ethics, but many medical ethicists are philosophers, are theologians, are people from humanities, and they are not so experienced, not that much educated in empirical studies or in empirical methodologies, and in that sense they are also more doing philosophically based research and not empirical research. So I think that is the difference between nursing ethics and medical ethics. But the question is still, is this a strength or a weakness for nursing ethics? I think it's important that also in nursing ethics there is enough philosophical input, and there is also enough robust philosophical research. And I would like to explain that a bit further, because what we found in our research in the last, let's say, 20 years is that principlism, and principlism is a typical medical ethics framework, that the principlist approach is quite influential, dominant even in nursing ethics. I give here three examples of reviews of ethical literature that we did on typically nursing topics. And in the 3 cases, we saw that the ethics literature that we included in our studies, that this ethical literature is dominated by the principlist approach. What is a medical ethics approach, not a nursing ethics approach. For instance, the first example is a review on nursing ethics perspectives on euthanasia. There we saw that respect for autonomy and non-maleficence are the major arguments pro and contra euthanasia, and that is based on the principlist approach. Another study 10 years ago about aged sexuality are also a topic where nurses in nursing homes, for instance, are confronted with many times. That also that literature on the ethics of age sexuality was dominated by the principle of autonomy, as there is a lot of emphasis on being able to give consent of the older adult, etc. In that study, we saw less emphasis on concepts like embodiment or concepts as relationality or responsibility or whatever. And then more recently, in 2021, we had an argument-based literature review on electronic tracking devices in dementia care, also a technique that is used by nurses. And also here, the last majority of the ethics literature was based on the 4 principles. So there is a real dominance of the principlist ethics in nursing ethics. You know, I suppose, what principlism means of the principlist approach. It comes from the United States. From the 70s, the book Principles of Biomedical Ethics of Beecham and Childress was published in 1979, I think. And it describes 4 principles: the respect for autonomy principle, the beneficence principle, that means that you should do good, the non-maleficence principle, that means that you should avoid harm and prevent harm, and the justice principle that can be applied to the fact that, for instance, healthcare services should be accessible for everyone without discrimination. Well, according to this approach, an ethical conflict or an ethical dilemma appears when 2 or more of these principles comes into conflict. For instance, in the case of euthanasia, you have an autonomous wish of an adult person to be euthanized. Principally, this should be respected. But on the other hand, if you euthanize a person, for instance, a psychiatric person or a person with psychiatric disease who suffers severely, but you can also interpreting killing this person as doing harm to that person. Of course, it depends on what harm means and how you interpret it. But here you can say, well, there are 2 principles who come into conflict. That is the typical way of arguing, reasoning according to a principlist approach. Now, you also know that there is a lot of critique towards the principlist approach that came from the 80s, the 90s, for instance, from the care ethicists. And here I list the main critiques to the principlist approach. For instance, the first critique is that we should not only focus on one act, for instance, doing abortion or doing euthanasia. That is seen as one isolated act. But when we do an ethical evaluation of care, we should look to the full care process. Also, in the case of euthanasia, based on qualitative research that we did in Flanders many years ago, we found that euthanasia can be considered as a care process that starts already when the patient requests euthanasia the first time, for instance, to the nurse, and then the whole decision-making process, all the preparations, the final decision, and the euthanasia act as such can be considered as part of that care process. And when we apply an ethical analysis of these practices, we should focus on the full practices and not on the individual isolated acts. That is one critique to the principlist approach. Another is that the principlist approach has more interest in observable acts. What should I do is the basic question according to the principlist approach. But we all know that in ethics, there are also other important questions. For instance, how should I behave to a fellow human being? And the attitude that I express. For instance, in nursing, you can wash a patient, and you can do that according to a fixed washing procedure. That are technical acts, could say. But while executing these practical acts, you also express a certain attitude, and you can express an attitude of respect, or you can express an attitude of non-respect while doing the washing procedure. So what you are doing is exactly the same, but the way how you do it is different. And that is, of course, from an ethical perspective, very relevant. Another critique is that the principlist approach is more applicable and interested in the big life and death topics, because that were also the topics that were discussed in the beginning of medical ethics in the 70s. But we also know now, for instance, in nursing, and the journal Nursing Ethics has shown that very clearly, that there are also daily care topics that are ethically relevant. So we should broaden the field of ethics in healthcare. There is also not only an emphasis needed on the responsibility, the ethical responsibility of doctors, but to the ethical responsibility of all members of the healthcare team. For instance, nurses, but also the family members, but also the managers of healthcare institutions have an important ethical responsibility. That means that we should also not only focus on the clinical context, the doctor-patient relationship, but the doctor-patient relationship, care relationship, patient care, the patient-nurse relationship, and so on and so on. They are all embedded in a broader institutional setting and even a societal setting. For instance, the fact that we in Belgium have a euthanasia law, what is a societal agreement, well, this has a very big impact on the way how nurses and doctors behave and decide regarding end-of-life issues. So the societal context is very important, as well as the institutional context. End-of-life issues in a hospital are different than end-of-life issues in a nursing home, and are also quite different as end-of-life care practices in home care settings. So the setting is also very influential for the ethical issues that are at stake. And of course, also, we should say that the principlist approach is more interested in people, patients who are able to give consent, who are competent, who can express the respect for autonomy. Yeah, because respect for autonomy is a major, very important principle in the principlist approach. But we also know that, for instance, in psychiatry or in geriatrics, or also in nursing, also pediatrics or neonatology, there are a lot of ethical issues linked to patients who are not competent. And also there we should care in an ethically good way, without being able to give or to ask the opinion of the patient. So care for incompetent patients needs another approach than an approach that is based on respect for autonomy as the major or most important principle. So that is the critique to the principlist approach. And then based on all this critique, I try to develop my own approach that is based, of course, on my own background that I show here very briefly. I started as a theologian. I started with studying theology in the 80s, and I was introduced by personalist ethics, by the ethics of Emmanuel Levinas, with professors as Paul Gastmans and Roger Burggraven. And then I moved to my PhD, where I was confronted or interested in the more care ethical approach, and especially Joan Tronto with her book Moral Boundaries was a very influential impetus for me during my PhD studies. After my studies, my PhD studies, I started doing also more empirical research due to good collaboration with my colleague Bernadette Dirks de Casterlee. I was introduced in qualitative research, and since then I am doing theoretical, philosophical, care ethical research, but on the other hand also a lot of qualitative research, and I try to combine both and to realize some dialogue between philosophical and empirical data. So that is my background. I will show some highlights, some elements that I developed during the last 30 years, let's say. And the first one is my view on nursing, because it's very important to have a foundational view on nursing. What is nursing? And already in 1998, I published a publication based on my PhD, Nursing Considered as Moral Practice, that was published in the Kennedy Institute of Ethics. And in that publication, I defined nursing as the totality of skills and attitudes, what I called caring behavior. And here you see both the skills, things that I do, but also the attitudes, the way how I behave myself towards fellow human beings. So the totality of skills and attitudes that are applied in the context of a particular caring relationship with the intention of providing good care to the sick fellow person. So three concepts are very important here: the skills and the attitudes. Second, the caring relationship, because the caring relationship is the foundation of all care practices, nursing care practices. But these care practices have also a particular goal, and the goal is good care. What is an ethical goal? You can also translate that in dignified care or something like that. So that is my basic characterization of nursing that I developed 25 years ago. Based on this characterization, I identified three basic characteristics of nursing as a moral practice. The first one is that nursing has an intersubjective character. That means in nursing, by providing care, the nurse enters into a caring relationship with a patient. And the nurse does not only enter as a professional, but also as a person into a relationship with the patient. That is the basis of nurses, I think. The caregiving relationship is in itself a concrete form of these kinds of interpersonal relationship. That is the first characterization. The second characterization is that when we are into a relationship with patients, that and also with our colleague nurses, the doctors, the family members, and so on. So what is here very essential is that we come into a communication with each other and that we try to understand each other as good as possible. So nursing practices develop themselves throughout time. It is a process. Nursing practice can never be reduced to a particular act that is done in a single moment. A nursing practice is always a variety of acts and attitudes that are developed throughout time within a relationship. And in order to find the good answer to the vulnerability of a patient, it is necessary, it is required that all the people involved go into dialogue with each other and that they try to understand each other as well as possible, because there can be much communication within healthcare, but that is not a guarantee that people who receive the information understand each other. So the hermeneutical, interpretative aspect is a very, very important aspect of nursing. And then the third characteristic that is very important for nursing as a moral practice is moral perception. Moral perception is essentially something what, for instance, John Tronto explained with her attitude of attentiveness. That means that the nurse, again, as a person, and not only as a professional, but as a person, is attentive to what happens around her and tries to detect situations where the life-sustaining web containing the others is weakened. That is the formulation of also John Tronto, of course. Being attentive means being focused on the other, trying to understand what's wrong with the other fellow human being, and then based on that insight, try to find the best answer to that human vulnerability. That means that you are not indifferent to the other, but you are touched by the situation of the other. You are concerned, you are worrying about what happens with the other person. That also implies that you are sensitive to the particularity of every situation. And nursing always happens in concrete situations. Nursing is not a practice where general rules can be applied. Of course, there are routines, there are general rules that should be respected, but these routines, these general rules should always be applied in concrete situations. And that requires sometimes that the rules and the situations are adapted. That is, the sensitivity to that particularity is very typical for nursing. Then some years, 15 years later, 15 years after my first publication, I had another publication on nursing and the essence of nursing, the ethical essence of nursing, and there I gave the following characterization of the ethical essence of nursing, namely, it is providing care in response to the vulnerability of a human being in order to maintain, to protect, and to promote dignity of the fellow human being as much as possible. And here in this characterization, you see three concepts: the concept of care, concept of vulnerability, and the concept of dignity. And these are, for me, the three basic or key concepts for nursing ethics. And I would say for the future, there is still a lot of research needed, empirical research, but also philosophical research, to really understand these concepts and to apply them in the context of nursing. Vulnerability, according to me, is a basic, profound lived experience that we all share. Not only the patient is vulnerable, but also nurses, doctors, family members who are confronted with an ethically sensitive situation. They are all vulnerable. So it is a shared lived experience, I think. Care, of course, is also a very important concept, because care can be considered as the interpretative dialogical process itself. It is through care, through caring interactions, that we communicate with each other, and that we try to understand what is the best solution for the vulnerability of a particular human being. And then the aim, or the normative standard that we use to assess the humanity or the ethical quality of care practices, is the standard of dignity. And of course, also that is a quite difficult concept in ethics. Based on these three concepts, I developed a framework, dignity enhancing care. I have no time to explain it now, but that is what I tried to do in the past years. But now I would like to show some foundational pathways for nursing ethics in the future. I will not develop them in depth, because there is no time for that in 1 hour, of course, but I give just some ideas for further research. And I think there are three interesting pathways for nursing ethics. The first one is the care ethical approach. There is already a lot of research on care ethics and the link with nursing. The second one is the virtue ethics approach. The previous speaker also explained the meaning of virtue ethics and virtues. And the third approach is the relational ethics approach. I will say something about these three approaches. And what is interesting in these three approaches is that when we look to the history of nursing ethics, and then I do not refer to the last 20 years, but I refer to the first codes of nursing ethics and the first handbooks on nursing ethics that were written more than 100 years ago. So when we look to the real history of nursing ethics, then you will see that already these approaches, although they used other names, but these ideas were already expressed in the very first handbooks of nursing ethics. The role of care, the role of virtues, and the role of relationship. That was already mentioned more than 100 years ago. And I think we should take that specific tradition of nursing ethics and develop it further, more than relying on a principlist approach, for instance, as I mentioned before, because the principlist approach is an approach that is not typical for nursing. It is much more linked to medical ethics. And that is then my answer to my basic question in the beginning of my presentation, that I think that nursing should develop a particular unique nursing ethics philosophical foundation. And that can be done with using these approaches. Well, I would like to say something about these three approaches very briefly. First one is that nursing ethics has an affinity, a sort of natural affinity with care ethics, because the concept of care is of course important in nursing and in care ethics. There is also some feminist link. Most of the nurses are women, so there are many feminist authors also interested in care ethics and in nursing. And both care ethics as nursing ethics are interested in ethical issues in daily care practices. So there is a natural link, but we cannot say that care ethics can be reduced to nursing ethics. Care ethics is a much broader ethical perspective that can also be applied to all kinds of ethical issues outside nursing. For instance, you can also apply the care ethical approach to very technical medical issues. So the misunderstanding would be that nursing ethics and care ethics is the same. It is not the same. Care ethics is an ethical perspective that can be applied to all kinds of ethical issues, but nursing practices are, of course, a nice field where that care ethical perspective can be applied. Another approach is the virtue ethical approach. In the previous lecture, there was already mentioning of the virtues of courage, for instance, and courage is an important virtue also in nursing. Care can also be considered as a moral virtue. For instance, Lawrence Bloom developed a very nice theory of care as a moral virtue. So the virtue ethics approach is very closely linked to an ethical view on nursing. And here I also refer to the work of Linus Vallare, who is with you today. He developed the experiential learning lab, the care ethics lab, the Stimul lab, where people, nurses or other healthcare professionals are stimulated to express virtuous behavior through experiential learning. That is a very good, innovative tool in nursing ethics that should be developed further. And also I refer to his recent publication with Roger Burggraaf about bodily contrast experiences in cultivating character of care. So also here, the character of care, the virtue ethical approach is very present. So that is important research that should be further developed. And then the third approach is the relational approach. And there I refer to another article I wrote several years ago with Carlos Gomez Verceda from Spain about relational autonomy. Relational autonomy is a very good approach to be used in nursing ethics because, it is also based on the emphasis on relationships. And as I said before, one of the typical aspects of nursing is the relationship between the nurse and the patient. Here you see the philosophical sources for such a relational ethics approach is multiple. You have feminist ethicists, care ethicists, phenomenologists, personalist ethics, virtue ethics that also rely on relational approaches. You see also the concepts that are used in a relational anthropology: connectiveness, interdependency, the other-centeredness, the embodied self, vulnerability, the reciprocity, the responsibility. All these concepts are very nice, interesting concepts in nursing ethics. And also when we look to practical tools, then you see, for instance, the shared decision-making model, but also the advanced care planning model, who are very popular at the moment in geriatrics, but also in other fields in healthcare. Well, they are all based on relational approaches on ethics. And so that is, according to me, also a very important source for nursing ethics to develop further. What are now some thematic pathways for nursing ethics? Well, what we should avoid, of course, is what I found 30 years ago when I was doing my PhD research. At that time, there was some kind of opposition between an ethics for doctors and an ethics for nurses. And that was framed in very oppositional concepts. For instance, an ethics for doctors that was a masculine, a male ethics, and an ethics for nurses that was a female ethics. Or the ethics for doctors was cure-oriented and the ethics for nurses was care-oriented. Or the ethics for doctors was a rational ethics, the ethics for nurses was an emotional ethics. The ethics of doctors was based on principles, the ethics of nurses based on virtues. Well, that is, of course, the wrong way to frame nursing ethics and medical ethics. We don't like ethical separatism here. And we should see what they have in common and what distinguishes medical ethics and from nursing ethics. What I show here are some ideas to look to very particular specificities of nursing ethics, what makes nursing ethics different from medical ethics. And that is based on the specific responsibilities of nurses. For instance, they should communicate with the family, they should guarantee the continuity of care. And that implies several responsibilities and ethical responsibilities. So that makes nursing ethics typical. Another element is the specific expertise of nurses. For instance, their observation practices, the experiences, understanding the experiences of the patient. That is typical for nursing, and there you can build research on. The specific position of the nurse, that was already mentioned in the beginning of my presentation, the in-between position, the nurse who is between the patient and the family, between the patient and the doctor, between the patient and the colleagues, between the patient and the institution. That is the in-between position. It is it's a very difficult position, I think, but on the other hand, also a very key position. Well, you can do research about what it means to be in such an in-between position. There are specific topics for nursing ethics, like dealing with physical restraint, with mealtime care, and we see in the literature a lot of research about these kinds of topics. But you can also look to other topics that sounds more medical ethics topics, but you can do research from a nursing ethics perspective. For instance, euthanasia. Nurses are very, very much involved in euthanasia care practices. So you can do research from an ethical perspective on euthanasia or in other end-of-life care practices. But you can also look to from another way, in another way, to the specificity of nursing ethics. For instance, to look to the several levels that you can identify, and with every level, there are typical topics for nursing ethics. For instance, when we look to the global level, nowadays we are dealing with very difficult environmental issues. These issues also appear in healthcare and in nursing. So you can develop nursing ethics research on environmental issues in health from an ethical perspective. Or the care for undocumented persons, migration of persons, and the responsibility of nurses, but also nurse migration. Nurses from India and so on who come to the West for filling in positions, nursing positions. There are a lot of ethical issues, and nursing ethicists are the persons who can take the lead in this kind of research. On the societal level, you have research on caring communities. How is caring embedded in the communities, in neighborhoods, etc.? Are the inequalities and discrimination in society, and the role of informal care in society. Also with these topics, there are ethical issues linked with, and nursing ethicists are the persons who can do research on that. On the institutional organizational level, there are topics like ethical leadership, moral distress, that is of course a topic that is already a little bit over researched maybe, but also the role of nurses in ethics committees is an important topic. So also there are topics that can be further explored. And on the individual relational level, you have concepts like consensus objections, for instance, in end-of-life care, how to deal with consensus objections of nurses in end-of-life care or in beginning of life, the family perspectives on different ethical issues, the use of innovative technologies in daily care practices, that are all topics that can be explored from a nursing ethical perspective. And then lastly, I will also mention some methodological pathways for nursing ethics. And I think here, and that is the same for medical ethics, we should use all kinds of methodologies. When we are going to try to understand complex ethical phenomena, and ethical issues are always complex, well, then we should apply different methodologies. That is what we try to do in our own PhD programs. Persons who make a PhD in the Center of Medical Ethics, they should do a literature review, they should do an empirical study, and they should do a philosophical study. And they should combine it, because when you use all these methodologies and apply them to the same topic, then, and more importantly, you develop a dialogue between the results of these different studies, then you have the opportunity to get deeper insight into the phenomenon. So a review of empirical literature is important, both quantitative and qualitative literature, but also reviews of argument-based literature. Argument-based literature is ethics literature. And here I would refer to a reporting guide that is just published 1 year ago, 2023, and where we actively participated in. It is a reporting guide for systematic reviews in ethics. It is published in open access online. And then, of course, we need original empirical studies, both quantitative studies and qualitative studies. We need, of course, also philosophical, theoretical, ethical studies. And as I said before, we should combine we should develop a dialogue between the results of these different studies, and that is the most important aspect, of course. So I think I am at the end of my presentation. Thank you. I suppose there is some time left for questions or remarks. I will stop share my screen.